So thinking about the progression of acute inflammation, what happens? You got to remember we're talking about acute here. It's fast. These things occur quickly. And it occurs in 3 phases. These are the initial vascular phase, then we have the formation of cell-free exudate, and then the formation of cellular exudate. So thinking first then about the initial vascular phase, this is when you get these 5 cardinal symptoms start to happen, particularly redness, pain, swelling, and heat. The cells that have been damaged by whatever stimuli is causing the acute inflammation release histamine. When we talked about white blood cells, about leukocytes, we refer to one of them as being a mast cell. And these are the cells that release histamine. And that causes this inflammation. You might be aware of something called antihistamines, which are medications that people would take for if they have allergies. So if they have a hyper response to something, or if you've got hay fever or something like that. So antihistamines are aiming to reduce inflammation because histamine is the natural substance that's released by our cells when they're damaged to initiate inflammation. And the very first thing that happens is vasodilation. So the smooth muscle in the vessel walls relaxes and the vessels expand, which causes increased blood flow to the area. And the reason for that is if we have more blood flowing to the area, we have more availability of our immune cells, our defense cells, the white blood cells. The more blood in the area, the more white blood cells that can ease out of the bloodstream to the area. The other thing that also happens, of course, is if you've got increased blood flow to the area, there's more flow through to try and get rid of whatever the problem is. So just from a physical point of view, that will help to reduce the amount of stimuli that's in the area, particularly if it's because of some kind of invasion or chemical. Because there's more blood flow to the area, you get more pressure on the within the vessel, and so we refer to that as increased hydrostatic pressure, hydro because it's fluid, and that exerts pressure on the walls of the vessel. So the walls of the vessel have relaxed, so they're thinner, and there's a lot more fluid within the vessel in the first place. And this all leads to the vessels becoming a bit more permeable. So these are capillaries. They're only one cell thick with squamous cell epithelium, simple epithelium. So it's already fairly permeable, but when you've got a lot of pressure inside there, the vessel becomes more permeable. Vessel permeability can be affected by 2 things. We refer to these as non-mediated and mediated. So what this means is how much stuff can get out of the vessel. Ultimately, this is the point in this initial vascular phase. It's to get the blood cells, the defense cells, to the area. So we want the vessel to be fairly permeable. And that's why we've got 2 methods that we can use, and we can use them simultaneously. So in a non-mediated way, this is quite simply if there's been damage to the vessel wall. So if we go back to that diagram we had there, the vessel, the capillary is damaged. So obviously it's fairly permeable and things can get in and out now. But the other way in which the vessel permeability changes is referred to as mediated. So it's more controlled. And this is when we have chemical mediators. Our body is releasing mediators to make the vessel more permeable, so chemicals released, in order for more of these defense cells to get out of the vessel and into the tissues. So this is all this part of this initial vascular phase, and the whole point is to get the stuff there. This is why we get swelling, why we get redness, and why we get heat. Because we are increasing the blood flow to the area. It's red, so the tissues get red. We're increasing the amount of fluid in the area, so it has to go somewhere, so it's swollen. And the more blood there is, the warmer the area is going to be. How quick this happens depends on what the problem is. We refer to as immediate, delayed, or immediate but prolonged. It's all part of acute inflammation. So immediate, obviously, as the name would suggest, happens straight away. We're talking a very quick response time, but it is transient. It comes and it goes as quick as it's come. So we're talking 30 to 60 minutes and no more. It's caused directly by the histamine. In this situation, in immediate response, it's the histamine that's the chemical mediator that causes the vessels to become permeable. The second one, delayed, as the name would suggest, is not quite as quick as an immediate response, and it can occur 2 to 3 hours after whatever's stimulating the acute inflammation, usually injury. But it lasts longer, so we're talking up to about 8 hours. So this whole 8-hour period, vessel permeability is increased. So you're going to get a lot of redness and swelling and heat, and therefore more pain. Anything that's swollen will be painful because the tissues are stretched and therefore it becomes uncomfortable. It's caused by complement, which is one of the things we talked about when we talked about the immune system. This process of proteins, a cascade that occurs to complement the immune response, and also something called bradykinin, which is a protein that we find within the blood. And the last is immediate but prolonged. So we've kind of got a combination of the two there. It happens straight away, but it's not transient like the immediate on its own is. And it can last up to 24 hours. And this happens because the vessel has become damaged directly. It's this non-mediated vessel permeability. So obviously it's going to take time for that damage to heal before the vessel stops being permeable. So 24 hours, perhaps even longer, because we've got direct damage to the lining of the vessel itself. So this initial vascular phase can last up to 24 hours, depending on the response time, from 30 minutes of immediate up to 24 hours for the immediate but prolonged. Moving back then to talk about the second stage of acute inflammation, where we've got formation of cell-free exudate. So in that first vascular phase, the vessel has become permeable, and therefore we get a lot of fluid leaking from the vessel into the damaged tissue. This is before the cells have managed to get through yet, it's just the fluid, and the fluid serves lots of purposes. It dilutes whatever is causing the issue. So if it's chemical, for example, it's going to dilute the toxins and therefore they will cause less damage. Similarly, if it's an infection, an invasion of some kind by some kind of bacteria or virus or fungus, the more fluid you have in the area, the less effect those will have. The fluid is also protein rich because it's come from the blood vessels. So it's providing nutrition for the immune cells that are already in the area. So when we talked about connective tissue, you remember that we had wandering and we had fixed cells, and some of the fixed cells, so the cells that were always in the connective tissue, were immune cells like macrophages. They're going out blindly to get rid of whatever it is that our body's recognising as non-self, but they need some kind of nutrition. So this cell-free exudate that's coming due to vessel permeability will help nourish those cells. It's a bit of a transport medium for all these chemicals that are flying around, these inflammatory mediators that we already spoke about. It allows them to move around easily. And it also is part of the lymphatic system because it's fluid, and the fluid will be drained away through the lymphatic system. And as it's draining through the lymphatic system, it's going to pass through the lymph nodes and activate the lymphocytes, particularly the memory cells, that may recognise this from a previous situation. So the cell-free exudate, although being quite a small phase of the process of acute inflammation, it serves multiple functions to help progress the response as a whole. And then lastly, with acute inflammation, we talk about cellular exudate. So this is when the cells are managing to leave the vessel, the white blood cells, and move into the tissues to be able to really deal with the stimuli. These are the big boys coming to break up the fight. It happens through a process of margination and then diapedesis. So margination is when the cells stick to the walls of the vessel, the inside walls. And then diapedesis is the process that they use to get out of the vessel. They squeeze through the gaps, basically. It occurs because the chemical mediators are being released in the area of damage, and the cells that are found predominantly leaving the vessels in the acute inflammation are neutrophils. So the neutrophil is what we refer to as the defining cell of acute inflammation. It's one of the ways in which we can diagnose, or medically professionals can diagnose, whether we're looking at acute or chronic inflammation, because there'll be a huge number of neutrophils. They're great cells. They are really mobile. They can get to where they need to get quickly. They will adhere to the microorganisms that are there and phagocytose them directly. So if that's what's causing, if that's the stimuli, they can get in there and get rid of them straight away. They also go through are responsible for a process called opsonization. Because the neutrophils themselves are quite small, and compared to things like macrophages, they're not very good at getting rid of larger organisms or larger stimuli. So they recognise that it's too big to deal with themselves and they can't do it, but what they will do is coat the membrane of whatever the stimuli is with proteins, which will help other larger cells recognise them for destruction. So they're sticking a flag on saying macrophages, come and get this, if they can't do it themselves. So they're hugely active cells that play a very important role in acute inflammation. And that's why acute inflammation is so fast, because the neutrophils can get to the area really quickly because of their mobility. This is something that you should be familiar with. I talked about it when we did white blood cells. We also talked about it when we talked about the immune system. We talked a lot about agranulocytes so far, and particularly lymphocytes. But your neutrophils are granulocytes, and they come into the same category where you find basophils and eosinophils. They are less specific than your lymphocytes, but they're smaller and they're more active. So how do the neutrophils know to go to that area? Yes, we've got increased vessel permeability, so they can get out of the vessel, but how are they in the vessel in the first place? Well, this is something called chemotaxis. And the definition that we've got there is movement of a motile cell or organism, or part of one, in a direction corresponding to the gradient of increasing or decreasing concentration of a particular substance. So basically, it's a very long-winded way of saying that the cells move towards an area where the chemical mediator is telling them to go. Chemical mediators are being released by the damaged tissue, so there's lots of them in the area. The neutrophils recognise that and flood to the area. It's the damaged tissue that are releasing these chemotactic factors, and they mediate the movement. The factors also bind to the surface of the neutrophils when they get there, so that they can continue to attract more neutrophils to the area until such a time when we no longer require them. And these mediators are things like the histamines that we've already talked about, prostaglandins, leukotrienes, and also from other things that you'll find in plasma, like complement and coagulation factors. So there are various different chemicals that cause the neutrophils to be attracted to the area. So like I say, the histamines, prostaglandins, leukotrienes, and various things from blood plasma itself. And they concentrate in the area. We always have all these things floating around in the blood, but when the vessel permeability is increased because of acute inflammation, these all gather in that particular area.